what we are doing differently is that when a patient, for example, comes in and they have sickle cells and they are starting to get complications, like they have a stroke, or their routine visits to the hospital have really become more, they are coming in now and then for a transfusion, then those are the patients that actually qualify for this type of treatment. So when a patient comes in and they have maybe been through this, we will do what we call a red blood cell exchange. What happens in this exchange? The machine will take out the sickled red blood cells, and in turn we will be infusing the normal red blood cells. So as we are taking out, we are at the same time bringing in. It's done concurrently. For example, a leukemia patient will walk in with a very high number of white blood cells. So when this patient comes in, they are at risk of getting so many complications, like because the white blood cells are so many, they will block the blood vessels. So when they block the blood vessels, some of the patients will not be hearing, or they will not be seeing as a complication of the disease. So in this, we put the patient on the machine, and we do what we call a depletion, like we take out all these excess white blood cells. So this is done in just one day. Then when we put you on just medication that will take some bit of days or weeks.
And we have acquired equipment that is able to do this, and we are going to be working when it comes to the one of removing cells. The way we go to the blood bank to donate blood, now we shall be donating particular cells. If a person goes to donate, for example, you have a person who is bleeding and he needs platelets, we shall say, oh, come and help us donate platelets. You sit on a machine, it removes the amount that we need or the dose that we need, and we give it to the patient.